For people suffering a stroke, the effects on the body can be dangerous, even deadly. But it's important to know that treatments are available. The key is to seek help immediately.
When the patient comes to us, you have a blood vessel that was supposed to be delivering the oxygen every minute to the brain. That supply has been shut down acutely, and we're losing brain cells by the minute.
Hi, Dr. Belmont. Nice to meet you.
When a stroke victim arrives at a hospital, the medical team quickly determines what type of stroke the patient is having. A hemorrhagic stroke, which occurs when a blood vessel ruptures and spills blood into the brain.
Open your eyes. Tell me what you see in this card here.
Or an ischemic stroke, which is caused when a blocked artery cuts off the brain's blood supply.
Right there. Please stop.
Using a CT scan or MRI, physicians review detailed images of the brain to examine the damaged area.
Until we get that CAT scan completed, we won't know which way we have to go, whether we need to call our neurosurgery colleagues to come and take this patient immediately to the operating room, or whether we need to think about drugs that can break up the clot.
If the diagnostic image reveals that an ischemic stroke has occurred, the first line of treatment is to administer a clot-busting medication known as tissue plasminogen activator, or TPA.
It has the ability to open up a blood vessel that's plugged up and causing a stroke. And by opening up this blood vessel, you can restore blood flow to the brain and reverse the symptoms of a stroke.
Though TPA is a powerful drug, it must be delivered within 3 hours of the onset of symptoms to be effective.
That means you need to get to the hospital, we need to evaluate you, do blood tests, do a CT scan, and get that medication into your body within 3 hours of stroke onset. And that can be very difficult to do.
Unfortunately, less than 5% of stroke patients get to the hospital in time to receive TPA. In cases where TPA is no longer an